Okay, so this group of instruments are going to be your cutting and dissecting instruments. In general, that means that they will have some type of a sharp edge on them, where you can use them for what we call a sharp dissection, where we're actually cutting the tissue in order to dissect it, as compared to blunt dissection, where we actually just separate the tissue planes. So the first items that we're going to show you here are our scalpels and our various different scalpel blades here. So you can see that our first scalpel blade we have listed here is a 10 blade. It has a very large cutting edge, so we use it to make large incisions into structures like the abdomen, total joints, things like that, where we're going to have a long incision. You can see the 15 blade is similar to the 10 blade, except it has a much smaller cutting edge, and therefore the incisions that it makes are going to be on smaller anatomy. Hands, feet, the face, something like that, where the incision length isn't going to be as long as it would be for a number 10 blade. The 11 blade, you can see, is very sharp and pointed at the end, so it makes what we call as a stab wound, which is usually created prior to placement of what we call as a trocar, which is an item that we put into a body area in order to pass instrumentations through when we do a scope type of a procedure. We can also use it to puncture a cyst of some kind, and again create that stab incision, where instead of it being a long incision, it's more of a down incision, down dissecting through the layers instead of cutting across the skin layer. The 20 blade is really the largest of the most common blades that we use. Not very commonly used, but really it's bigger than the 10 blade and could be utilized for really some of the same types of incisions. Big, long incisions, a total hip, a big median sternotomy, something like that, where it's going to be big anatomy. The 12 blade, you can see, is sometimes referred to as a hook knife. It's got that hook to the end of it with just the cutting edge on that side. Really not very commonly used. Most common place that we see it used, if it is used, is going to be to dissect around a tonsil pillar on a tonsillectomy. On the very bottom here, you will see what we refer to as beaver blades, and these are just a few examples. There are all different kinds of beaver blades that come in all different sizes and shapes, and again they will be numbered similar to how these are, and you can see that the cutting edges on these are even smaller than any of the other blades that we saw. So those would be, of course, on very small anatomy, very small dissection and incisions that we might be using those types of blades on. Now, certain blades fit on certain sizes of handles, so we're going to show you the various different types of handles here. So the most common handle that you're going to see used is what we refer to as a number 3 handle. So it's always going to have the serrations here, or the finger grips here, that are very close together compared to a number 4 where you can see that they're further apart. Now the number 3 handle does come in different lengths. It comes in a basic length, which we would use for our initial skin incision. It comes in a longer length that we might use deep inside the abdomen when we're dissecting through structures. And then it also comes in an angled length, which sometimes we use when we're dissecting around the cervix, like on a total abdominal hysterectomy. This one's not very commonly utilized. More commonly you would see just the shorter length and then the longer length. You will see that these do have a number 3 down here at the bottom. They will tell you that they're a number 3. And the number 3 handle fits all of our basic knife blades except for the 20. So it fits the 10, the 15, the 11, and the 12. All of those will fit onto your number 3 handle. The number 4 handle that we were talking about, that has the larger serrations that are more separated from each other, only houses in this area the number 20 blade. So if you're going to use a number 20, it's not going to fit on the number 3 handle. It has to fit on the number 4 handle. And you will see that that comes in a short length and then also a long length as well. Another version of handles that we use that fits the same blades as the number 3 handle is the number 7 handle. Now the number 7 handle, you can see it's a lot narrower than the other handles that we've just talked about. It fits the exact same blades that the number 3 does. So it houses the 10, the 15, the 11, and the 12. We use this for dissecting in narrow cavities, such as in the throat or in the nose or even in the back of the knee, when we're trying to get to areas where these large bulky handles might get in the way. So a number 7 handle might be another handle that you could use depending on the anatomy that you are encountering, and can house the exact same blades as the number 3 does. Now those beaver blades that we showed you at the bottom here will fit on their own special handle, which is called a beaver handle. This beaver handle actually has two pieces. So it has a screw in the end of it and then the handle portion here, which is round. So what you will do is you feed this in, and then you would take one of those blades and feed it in, and then you will tighten down that screw until it's tight. And then you will be able to make your incision with that beaver blade housed inside that beaver handle. Now, in some facilities, they will utilize safety handles and safety blades. So a blade that's a safety blade has some type of a protective mechanism over the top in order to help prevent sharps injuries occurring when we're transferring the blade. So there's all different types of these, but they're very similar in how they load. So when we talk about how we load a knife, remember we always line up the bottom angle on the bottom of the blade with the angle that's at the bottom of the handle here. So when we load those, you're gonna just fit them together. The way that this safety mechanism retracts is you just push down on this and then it pulls back. And then in order to push it back, you just push it back over the blade. Now the idea behind these is that you're supposed to hand them up to the surgeon with that blade covered. They're supposed to open it up, make their incision, and then cover it back up before they hand it back to you as the surgical technologist, so that that blade is covered at all times so it wasn't able to cause any type of a sharps injury. To take the blade off, you just grab right at these serrations here on the blade and then pull it straight off. And then we would dispose of that in a sharps container. Even though it's protected, we still treat it like a sharp. Okay, some of our other instruments that also are in the same category are going to be your scissors, because they will have a sharp edge on them as well. Our first scissor that we're going to show you here is called a Metzenbaum, or a Metz for short. So in general, when we talk about scissors, scissors that have thin blades are used for dissecting fine, thin tissue, like peritoneum, bowel, anything that doesn't really need a lot of cutting power in order to dissect through it. When we use a scissor, we can use it one of two ways. For sharp dissection, they'll tend to turn it to the side and actually cut, like you're very familiar with using a scissor, like you would cut a piece of paper. Or they can take the blades and really use the outside portion of the blade, stick it between the tissue and kind of open it up. And that's called blunt dissection. And what that does is it just uses the body's natural tissue planes and dissects down through the tissue to expose the various different structures. So the Metz scissor, you can see, like we said before, has the very thin blades used for fine tissue. It does come in multiple lengths. This is the basic length. So this is what we would use for the initial dissection of going in through an abdomen. Deep inside the abdomen, we might use a longer length, just depending on the patient's size. Now, in comparison to the Metz, we have another very common scissor that we use, which is referred to as a Mayo scissor. So if you look at the blades on these two scissors, you can see that the difference is that, of course, the Metz scissors are much finer and the Mayo scissors have a lot thicker, heavier tips on them. So for the Mayo scissor, we're going to use that for very thick, heavy tissue. Muscle, when we're dissecting through the muscle fascia, if we're cutting through a joint capsule, if we're, if we had to make a cut into the uterus, something that's very thick, heavy types of tissue is what we're going to use a Mayo scissor for. So this also will come in various different lengths, just like the Metzenbaum, and is very commonly utilized during a case. Now, in general, also when it comes to scissors, anything that has a curved blade on it, we're going to use for dissection of tissue. Anything that has straight blades, we're going to use to cut suture, dressings, drapes, anything like that. You never want to use a curved scissor to cut anything else except for tissue, because you'll dull the blades, and sometimes you can cause little nicks in them that when we would dissect through the tissue, then it would give us rough edges, which are not going to heal very well. So the next scissor that we have is really a straight Mayo scissor, but we never call it a straight Mayo scissor. We only call it a suture scissor because that's what it's utilized to do. Remember, we said that we never use a curved scissor to cut suture. So the suture scissor does have those thick blades, just like the Mayo scissor. Of course, they're straight, and it will come in various lengths as well, depending on the depth of the suture that you need to be cutting inside the wound. Okay, another scissor that we have is referred to as a bandage scissor. So it can be utilized to cut bandages or cut the dressings off or remove the drapes at the end. It's going to have this blunt edge on it that will help to protect any injury to the patient's skin as we cut underneath a dressing in order to remove a dressing. Of course, we would want to utilize it in this position instead of this position, because then we would be poking into the patient's skin. Other times when we might use this is to extend the incision in the uterus on a C-section, because again, this portion of the scissor is going to protect the fetus's head from being injured as we extend that incision into the uterus to deliver the baby. So sometimes they'll use that to cut across the umbilical cord too, because it is a very thick, heavy scissor that can be utilized for that thick, heavy tissue. Another scissor that we have here is called a Jones. So you can see that the Jones scissor really is just a shorter version of the basic Metz. So the tips look very similar. They again are that fine tip that's going to be utilized for fine dissection. So commonly we would see a Jones used in like a hand case or a foot case, maybe an elbow case. We're going to have fine, delicate tissue that we're going to be dissecting through. The Jones only comes in one length, and it is shorter than the basic Metzenbaum. And of course the tips are going to be curved because we utilize that to cut tissue. Another scissor that we have is called a wire scissor, which by its name, of course, is utilized to cut surgical wire. Sometimes we use wire to fixate fractures or, all different reasons that we could utilize that during the case. And once we have the length that we need, then we need to cut that wire. And if we used any of the other scissors, we would damage that. So we need to use this specialized scissor to cut any wire that might be utilized during the surgical procedure. And one final scissor that you might have on your field is what we refer to as a utility scissor, or some places will call it a sharp blunt, because you can see one side is sharp and the other side is blunt. Now this is just kind of a catch-all scissor. It's just an extra scissor that you'll find in your sets or on your table that can be utilized to cut dressings, drapes, all those kinds of things, so that we don't dull our suture scissor. Because if you use your suture scissor to cut your dressings and your drapes, you're gonna have a really hard time cutting your suture. So this is kind of that extra scissor that we do any additional cutting that we need to do on our sterile field during the surgical procedure.